let's talk about some of the clinical evidence, okay? Which I have to applaud Orpyx for this, for the simple reason we can't just throw these out there without some hard and fast. And so, you know, Dr. Bolton, Reeves, all of these exceptionally brilliant people across the entire world actually were involved in this. And next slide, please. And their, their random controlled study really showed the reduction in compared to control. Okay, they had an intervention group, received pressure sensing orthotics, and there was about 32 of them. The control group received the same orthotics, okay, but they weren't alerted and when it was elevated pressures were detected. Okay, the primary outcome was plantar foot ulceration recurrence within 18 months. Okay, this is interesting things. They received the same sensory technology, the same orthotics, except they weren't alerted what was going on. Next slide, please. So this is the money slide right here, okay? Results of the random control study showed that patients receiving the real-time alerts and wearing them at least about 4.5 hours per day, 86% reduction in ulceration, at least 4.5 hours a day. 86%. And then overall, 71% reduction in ulceration. Okay? That's awesome. Both groups, showed statistically significant reduction in DFU. But one of the, like I alluded to in the slide before, it's interesting that they both received the insoles. They both received kind of the same information, however, no alerts. Okay? Those alerts were able to reduce the 86% and the 71% in the ulceration in all patients, which is fantastic. So I really think that this enables us to have an opportunity to have a discussion with these patients in terms of, listen, this is a time for a paradigm change. This is a time for you to be involved. And this is a time for you to take control of your life and prevent these ulcerations, prevent amputations. And we all know the cardiac effects when we start doing baloney amputations on these patients. We already alluded to that in terms of mortality. We have to stop this.